What is trauma-informed nutrition and how is it different than trauma-focused care?
Great. Yeah. Trauma is a really big topic now, and everyone seems to want to dip their toes in it for good reasons, right? There's a lot of research that shows the importance of trauma as a legacy over the lifespan and how it can really affect trajectories of individuals and groups, right? We think about trauma as being important in communities, in racial and ethnic groups, et cetera. So there's probably some really good definitions out there of trauma-informed care or trauma-informed, trauma-focused care, as you mentioned. But when I think about trauma-informed, that doesn't necessarily mean that an individual needs to discuss these things with someone. It means that there is a different set of assumptions at play. So when I use the term trauma-informed, the first thing that I really want to emphasize is that, the practitioner, the provider is really working to avoid re-traumatization. Okay. So any individuals that's been exposed to trauma has oftentimes, a higher level of vigilance to threats or different levels of sensitivity to certain conversations, et cetera. So trauma-informed nutrition is about cultivating trust, reducing shame, and like I said, avoiding re-traumatization. And that often comes through having a different set of assumptions. Yeah, when I think about trauma-informed nutrition, it really is about developing a set of assumptions about a person rather than about people in general. So you sort of start from this place that each person is different, each person has a different lived experience, and different things are going to be triggering for different people. And so nutrition by itself is triggering. You don't believe me? Try teaching nutrition in a group, right? Try to teach nutrition to a group of 10 people. And I guarantee you there'll be one person there that's triggered by something you're saying or they disagree, right? Let's say someone's been exposed to a lot of trauma, they have disordered eating, and now they're coming in for nutrition related care. And then the nutrition related care is not aware or not informed of this, previous exposure to adversity. Some of the interventions that are out there can actually make people worse.